So vaginoplasty, what is it and who should get it?
What's so interesting, as a busy GYN, we're always seeing patients coming through our doors. And my father has been in the community for more than 30 years delivering babies. And so most of these patients now are undergoing menopause, and they're telling us they have less intimacy, they're having less sensation with intimacy, they have vaginal laxity now, some have urinary incontinence, and simply put, they're just not fitting with their lovers again.
Okay.
And so when I talk to my patients, it really resonates with them because they're finding that over time, they cannot have intimacy in the way that they used to. So what they're saying to me is, Dr. Tangchitnob, when I have intimacy or I have sex with my husband, it feels different, or I just don't feel as much anymore.
Okay.
And it really resonates with me because we know that over time, hormones change, the tissue changes, and there's vaginal laxity, prolapse could happen. And so what a vaginoplasty is it's a tightening of the tissue, the vaginal tissue down below, to actually help with intimacy. It increases friction, because really that's the whole mechanism for intimacy is friction.
Okay.
And so what we're doing is we're intently and surgically basically putting the walls of the vaginal area together so that there's increased tightness, so that there's more sensation.
So what are you actually doing?
So we're actually going in, making small incisions. It's a minimally invasive procedure, and we're using sutures to selectively and tighten key areas so the patient can have better intimacy. A lot of times they come back to me and say, Dr. Tangchitnob, I feel like myself again. I feel like I could have intimacy in the way that I used to. And it gives patients self-confidence, and they're just so happy after the procedure. It's very life-changing.
So what's the downtime like?
So
off work, things like that.
Sure. So within about 2-3 days, patients are going back to normal life activities, activities around the house, back to work. But it's the after, Randy, and that's really the key, is when they feel like themselves again, they're able to have that intimacy that they've desired for so long now. Can they return
to the tightness that they were in their memory from their mid-20s, like a 40, 50-year-old? Could get that back?
Absolutely. I think depending on the consultation, and I think depending on the patient, we have to set preset expectations. In my practice, I try to do a very detailed analysis and detailed consultation to see what the level of tightness is. There's just 1 finger breath, 2 finger breaths, 3 finger breaths, and it's just so critical.
Is that right?
In the physician and patient shared decision-making model that we make together.
Now, you're a gynecological surgeon.
I am.
Are there people that are not gynecological surgeons allowed to do this procedure? Are they doing it?
I think other surgeons or surgeons who have surgical background are indeed doing this procedure. And so between you and I, it actually doesn't cost that much more to see a specialist trained in gynecologic surgery.
So are you combining this with your O shot, this PRP you inject, other like radio frequency or anything else in that area?
Absolutely. So I actually invented a special procedure called the Timeless Intimacy Protocol, by which we combine a variety of different approaches for the best outcome. And so what that means to the patient is that after we do a vaginoplasty, we perform an O-shot. And we just talked about what an O-shot is in an earlier part of the interview, in which we are basically injecting platelet-rich plasma, all the healing factors that the body has to help with orgasm, helps with urinary incontinence. And we are also combining it with a vaginal laser 6 weeks after. This is really what we call the full Timeless Intimacy Protocol.
So you're returning it. So it's a younger,
healthier, better functioning vaginal vault, helps with intimacy, helps with self-confidence. And so really the Timeless Intimacy Protocols, it's just so important for patients.
You can bring them back 10, 20 years?
We can bring them back 10, 20 years, sometimes even more. If they're in their 50s and they say get to the intimacy range of their 20s and 30s, then they're very, very happy.
So on the women that are worried about urinary incontinence or looseness, surgery sounds like, I don't want to do surgery. I want to try all these other things first. But in the right hands, is that a very safe procedure and very predictable procedure?
It is. And every patient is different, and we approach every patient differently. But that being said, sometimes patients can do non-invasive. Maybe when they come for the consultation, I had a patient a few weeks ago, for example. She said she was having pain with intimacy. I want a vaginoplasty. Then I do the exam, and I actually find out it's because she's undergoing menopause, and she has dryness and friction issues. She doesn't need a vaginoplasty.
Okay.
She doesn't need surgery. We gave her an O-shot, and we did some hormone optimization on her. She's coming back for a vaginal laser in a few weeks. So that's just an example of many different cases I have, that it really depends on the patient.
That's why going to an OB/GYN is very important.
Just so
to
critical.
Be able to diagnose
correct. And also
the real underlying cause.
Correct. Also, sometimes patients have concurrent issues. Maybe they have a bladder falling down. Maybe part of their rectum has changed. And so we are able to, as GYN surgeons, repair and fix those things, and not just be one solution for all different issues.
So it makes sense. I mean, if you're going to do this, go to a GYN, right?
I think so, absolutely. This is the area that we're most comfortable with. This is the area that we are well trained in. And I have a background of fellowship and specialty training in robotic and pelvic reconstructive surgery. And I also have actually had subsequent cosmetic surgery. Actually, I was trained by Dr. Red Allensod in Newport Beach.
Aren't you department head or something over at Queen of the Valley?
I'm actually the director of minimally invasive and GYN robotic surgery there. I have been so for the last 6 years. So
well, you and your father have pioneered a lot of things, published papers, things like that. I mean, you're well known in West Covina. In fact, I think you told me, you said that your father's almost delivered every baby in West Covina at one time, it seemed like.
Well, it's really interesting. I remember growing up, my sister, she's also a physician. I remember growing up, and when we were young, we would go out to a restaurant, and we couldn't almost always go out and,
he was always
and bump into someone that he delivered, or maybe delivered their kids. And it's such an honor and privilege to be working with my father in our practice.